Is National Heart Month, so what better time to learn more about CPR training?
Yeah, joining us now to tell us more about National Wear Red Day is Andrea Ooten with the American Heart Association. We've got Dr. George Dimeling and Courtney Blankenship, both with CHI St. Joseph Health. Thank you all for being here. We all got the memo of wearing red today, but the big day's tomorrow.
Correct.
So talk to us about Wear Red Day and the importance of it and the messaging behind it.
So February 3rd is an awareness day to raise the public's awareness to women's heart health. Over 44% of women aged 20 or older suffer from heart disease. And it was something that we used to think was protected by estrogen levels in younger patients, but we're finding out that there is a lot of coronary disease and other forms of heart disease in younger women. And so it should be on all people's radars and on their physicians' radars to diagnose and treat early to prevent, death.
And I know there was the big fashion show in New York, and all these celebrities always come out for Wear Red Day, and to see that kind of support and that push really helps you all deliver your message out there as well.
That's right. A lot of the sudden death and heart disease that happens outside the hospital. So these events occur in people's lives before a physician can ever intervene. And so we'd like to raise the public awareness so that their loved ones can be cared for at home and make it to the hospital so that we can then do our job and get them back on track.
And being with the American Heart Association, that's your goal, is to educate the folks, right?
Yes, absolutely. And we have set a very lofty goal of having one person in every household learn hands-only CPR before the end of 2024. So we're really excited. In Heart Month, our focus is Be the Beat and just making sure that we're getting that message out about hands-only CPR. So we're really excited today to be able to demonstrate that and show individuals how easy it is to take those steps if you have someone collapse from cardiac arrest.
And also just recently with what happened with Damar Hamlin, it's really kind of come to the forefront about CPR training and knowing what to do in a situation like that.
Yes, we're so grateful that Damar is having such a wonderful recovery, and it's a perfect example of how important it is to act fast in those situations. And you can see the quick action that they took during that incident on Monday Night Football really has made a big difference in his ability to bounce back.
And the fact that so many people right immediately after it flooded the internet wanted to learn more about CPR, and that's excellent news, and that's why you're here to try to help us out a little bit, aren't you?
I am. So hands-only CPR, anybody can do this. And I think what's important to remember is we no longer have to do the breaths. If you see somebody collapse, what you would need to do is call 911, and really we simply just want you to start chest compressions. Okay? You do not have to take the person's shirt off. You don't have to do anything uncomfortable, but you just need to find the middle of their chest, use the palm of the heel of your hand, and then we want you to use your other hand and straighten your arms and use all your body weight, and you just start compressing. Those compressions need to be about 2 inches deep, and they need to be pretty quick. We want you to do 100 to 120 in a minute's time. So back in the day, we'd always tell you to use the beat of Staying Alive. We're finding with the kids, like, not everybody knows that song anymore, but when we're thinking, okay, we've got to come up with a different song. But it's very simple. So dial 911 and then just start hard and fast. 1, 2, 3, 4, 5, 6, 7, 8. And just keep those compressions going as long as you can until EMS arrives. If you have somebody with you, you'll probably want to switch out because, really to get 2 inches deep and to do 100 to 120 compressions, it is physically exhausting. But you don't have to worry about the breaths. We just want you to circulate.
Keeping your composure too, I'm sure, in a moment like that as well, because I'm sure that's a scary situation to be in, especially if it's a loved one.
Yes.
Yeah, and unfortunately, that is the case so often. As we have about 350,000 out-of-hospital cardiac arrests that happen each year, and so frequently it is in your home that's going to happen. So it's going to be a loved one most likely that you're saving.
And really fast to know, we were just showing a graphic with an event that you all have coming up as well to promote this. Yeah,
so we are actually having our Serve Day. National Wear Red Day, of course, is on February 3rd, tomorrow. But from 11 to 1, we are hosting an event at Copper Roo where you can come out and learn hands-only CPR. So if you're interested in that, we encourage you to reach out to us and let us know that you're coming, and come by, and we'll be happy to show you how to do this.
Great.
Thank you all. We appreciate you and appreciate the training too.